So Obamacare is online, but not without a few hiccups. We have seen that already today. And many Obamacare websites meant to provide new access to the uninsured, seeing delays or breakdowns. Some trying to call a federal call center where customers can get signed up, reporting long wait times there. What can you expect? Brad Wenstrup's a Republican out of Ohio. He's a part of the Doctors Caucus. And Ted Poe is a Republican, first member of Congress to introduce a bill to repeal the individual mandate. And Dr. Manny Alvarez, senior managing editor of FoxNewsHealth.com and a member of our Fox News Medical A team. Dr. Manny, thank you you're going to play the role of the arbiter in all this, okay? And to talk to the members of Congress first here. And to Congressman Wenstrup, what is next right now? You know, what arrow is in the Republican quiver, or are you out of those at the moment?
Well, I don't think we're out of them at the moment. I would hope that the president would come and negotiate with us along with the Senate, and that we come up with some solutions that are going to be better for America. Nobody really wants a shutdown. The Republicans certainly don't want a shutdown. That's why we work so hard to come up with ideas that would keep the government running. But they were ignored and not even debated, and that's a problem. So hopefully we'll get to that point.
The subsidies for Congress, is that
well,
the
you
next
know where
point,
I stand.
Has that played out?
I hope it's not played out, because I think Americans, when they understand this, they want equality under the law. They want all of us to be treated equally. And that's one of the biggest problems that we have with the Affordable Care Act, amongst others. But the inequality amongst Americans is not the American way, not the way we should be doing business.
Let me bring in. Yeah, go ahead. Sorry.
Well, I mean, could you imagine if it was a President Romney that was just carving parts out of the law, what the reaction of this country would be?
Representative Poe, the glitches we have seen today, is that just today, do you believe?
No, I don't. We have to understand that the government now is in charge of America's health. This is a government program, like most government programs. It's expensive, too much bureaucracy. And it's not like October 1st just came up on the White House. They've been planning for years to implement this, and of course, it's not ready. And that's one of the reasons we wanted to postpone the whole thing for a year.
But this is
just the beginning.
Do Republicans have any more cards to play here?
Well, we want to talk to the president. The president refuses to talk to us. You know, Nero fiddled while Rome burned. The president played golf while the country shut down. Nero blamed the Christians. The president's blaming the Republicans. I believe they want to shut down to offer cover for the problems that are taking place. We just want to talk to the president. He'll talk to the Syrians. He'll talk to the Russians. He'll talk to the Iranians. But he won't talk to Congress. Government is supposed to work when you talk with each other. But the president won't talk to us. So we're in this for I don't know how long, but we'd like to talk to the president.
All right, gentlemen, stand by one moment here. I want to bring in Dr. Manny Alvarez with Allison to tell us what America can expect.
Yeah, Dr. Manny, today, how does your life as a doctor change starting today, and how do all of our lives as patients change?
Well, I think today is just the beginning of the major changes that healthcare is going to develop over the You know, this is socialized medicine. I've been writing about it now for a long period of time. What you're going to start seeing is a lot of private doctors leaving their practices and trying to join hospitals and big corporations. In other words, they're going to become employees.
Hasn't that been happening, Dr. Manny?
Oh, my God, it's happening by the buses full
but, I mean,
all around
not
America.
Just as a result of Obamacare. That's been happening.
Well, it's because we've been dealing with this issue for the last 3 years, uncertainty, but we knew it was coming. I knew the president was going to win, and I knew the Republicans were going to lose. This is something that was already in the cards. You know, it was not well strategized from an opposition, and this is exactly what happens.
So, Dr. Manny, do you agree with Congressman Poe there, who says government is now in charge of America's health care?
Government has been in charge of health care for the last year and a half, and it's going to get even worse, and that's fine. That's what people voted. We give the American people what they deserve, which is the change that they asked for in the last election. But let me tell you something. I think that what needs to happen moving forward is, you know, this reminds me when the HMOs came into preview back 15 years or 20 years ago. What you saw is everybody trying to get into the HMO business. A lot of them went out of business. A lot of people got really fooled by some of the HMOs that were being developed, and a lot of people got hurt. I think what the GOP needs to do now is monitor this new law, make sure that you follow up every incident, and you show and you create a report card, and you tell the American people 1 year later, after October 1st, 2014, what all the positives and all the negatives of the Obama health care law, and then you're going to see some national reactions, because you're going to have some.
For Brad Wenstrup, then, I mean, Manny Alvarez sees patients every day. You used to see patients every day before he became a member of Congress.
Right.
Is Manny right, or did he miss a point?
He is spot on, and I can tell you that coverage does not mean care. Just because someone has a piece of paper that says they're covered doesn't mean that they're going to get the care that they deserve, the care that they expect, and the care that their doctor wants to render. There's too much involvement from people that have never put their hands on a patient, and that's what we're going to see more of. And people are going to understand that, I think, pretty quickly, Bill.
What happens to the price, Representative Poe?
It goes up. It keeps going up. It's already expensive. It's so expensive that some people have had to even, employers have cut back on their employees. I have a constituent in Texas who was cut back to part-time because the employer couldn't afford this new health care law, and it hurt her so bad she had to send one of her kids to live with relatives. It's affecting people because it costs too much, it's not better care, and it certainly is not better for the American public.
Gentlemen, thanks to all three of you. We appreciate your insight. We will see who is right, or perhaps all three are. Ted Poe, Brad Wenstrup, Dr. Manny Alvarez. Thank you, gentlemen. Allison, what's next?
Well, World